jaw development, it's always better when we act sooner. As a general dentist, I have the advantage of tracking my patients from when they're young all the way until they're old. When I see these patients, I'm able to see their long-term results and what works and what doesn't. The disadvantage that a pediatrician or an orthodontist or a pediatric dentist has is that they only treat the patient during those young years, so they don't know what that patient is going to become. When a child is young and you constrict them and you narrow their arches and they have beautiful, perfectly straight teeth, they leave that orthodontist as a success story. They say their teeth are straight, they look good, but very quickly I see a lot of these children developing TMJ disorders, TMJ issues, and they wear down those perfectly beautiful straight teeth. But the orthodontist never knows that that happened because they don't have the advantage of seeing that kid again. As a general dentist, I have this very unique position in that I get to see the kids throughout their entire life, and I get to see the adults and the effect of improper treatment when they're younger. I know how important an expansive approach to orthodontics is because I'm treating that adult that even though they had perfectly beautiful straight teeth at age 12 or 13, they've now worn their teeth down to nothing, they're breaking teeth all the time, and they have chronic TMJ disorders and issues. And I know that if we would have expanded that child more when they were younger and not extracted their premolars, they would be in a much better situation now. At 2 years old, our jaws are already about 50% developed. Age 4, we're already at 75% development, and at 12 years old, we're already at 90% developed. So most conventional orthodontics, they're not gonna start treating the children until all of their adult teeth are in, which typically is around that 11, 12-year age range. These kids are already 90% developed. We're not gonna get those large bone growth changes that we need in these children when we wait that long. So it's very important to act between the ages of 5 and 10 so that we can make the biggest impact on the jaw growth of these children. And with jaw growth comes airway growth and comes long-term benefits and effects. There are things that we can do to overcome the limitations that our anatomy has presented us. We can do exercises to train our tongue and strengthen our muscles. There's a ton of things out there now that talk about different jaw exercises to make your chin and your cheek look better. And it's kind of funny, you see them on TikTok and all over the place, but there's actually some truth to that. When you chew and exercise your jaw muscles, the reason why your jaw gets more defined is because that jaw is coming more forward and more toned, and those people are actually getting a better airway as well. That's myofunctional therapy, is the reason why their jaw is looking better. I work with a myofunctional therapist, I refer my patients to them, and they will help see those improvements in your profile as well as your muscle tone and help you overcome the limitations that you had anatomically. We also may have to do tongue tie releases in order to allow your tongue to do what it's supposed to do and give the proper pressure that your jaws need for growth. And of course, there's a lot of appliances to help grow your jaw the way that it should, whether it's a removable orthodontic appliance or a fixed orthodontic appliance. Orthodontic treatment, surgical treatment, or sometimes it's simply just wearing an appliance at night to open your airway and help you breathe better. Incremental change can make a big impact. Some of my patients that we simply do Invisalign treatment and expand their jaws just a couple of millimeters feel so much better. Evaluate yourself and your children right now. First, check your structure. Is your jaw and mouth compromised? Then check your function. Are you breathing properly? Are your lips closed? Are you nasal breathing? Is your tongue in the right position? And then start working on incremental changes to make improvements to any of the function that could be improved. Every day, more doctors are being trained in airway-centric dentistry, so find one in your area. You can go to airwayhealthsolutions.com. There's a doctor locator right on there, and you can find other dentists like me that are trained to look at you comprehensively with an airway focus. Please follow me and watch more of my videos.